Welcome to Wednesday's edition of COVID-19. There has been a dramatic rebound in new infections today, with authorities recording well over 600 new cases. Now, meanwhile, on a bright note, Korea's vaccination campaign remains on track, and we have more on this effort later on in the program. Here first is the broader pandemic coverage with our Kwon So-ah. Now, So, let's begin with the alarming surge in the daily tally here.
Yes, Sunny, it's a surge by more than 250 infections. 645 cases were reported as of 12 a.m. this Wednesday. That means it is a jump from the 300s we had on Monday and Tuesday. And also, if you compare the figure to last Wednesday, we are seeing an on-week jump by 100 cases. So with that, in total, Korea has 152,545 infections, with 2,007 COVID-19 related deaths. Now, the hikes were especially reported in the capital region here, Seoul, at over 200, and Gyeonggi-do province also close to 200. And we are seeing larger sized cluster infections also here in Daejeon, with 58 new cases here. A cluster infection linked to a religious facility is said to involve the Alpha variant as well. Now, 605 of Wednesday's cases, meanwhile, were domestic transmissions and 40 were imported cases. So if we break it down by these two cases here, we are seeing the rise in domestic cases from the mid 300s to the low 600s. And here, this is also a concern here. For 4 straight days, imported cases have been in the 40s.
Right, and that particular trend has triggered fresh words of caution from authorities here.
Right, Sunny. Officials here are emphasizing that the revised social distancing system, which will take effect on July 1st, will give more freedom to citizens, but it also requires a higher sense of responsibility. So with that, they are asking for people to not get too lax with the changes to come, and especially when it comes to private gatherings.
Please refrain from meeting people and gathering in large groups, as well as drinking or eating for a long time, until mid-July. After-work company meals involving a large number of employees should be delayed, taking the vaccination process into consideration. This is to ensure that such gatherings do not suddenly increase, and meetings should take place between vaccinated people if possible.
Right, meetings among vaccinated people is also part of the incentives for inoculated people, of which we now have over 15 million. And that's the number of people who received at least 1 dose of COVID-19 vaccine, and it's equivalent to 29.4% of the country's population, while almost 4.3 million are fully vaccinated. That would be 8.4% of the population. Officials are also stressing the need of protection against variants through vaccination, which our Yujihago is going to go into the details in a bit. But before that, with variants becoming dominant strains abroad, a mutation of the Delta variant that was first detected in India, the Delta Plus variant, has been now raised from a variant of interest to a variant of concern by Indian health officials, following around 24 of cases found in 3 states. Now let's also take a look at the numbers abroad. We are seeing India here having surpassed the 30 million mark in total cases. However, daily infections at around 54,000 are lower than the 86,000 new cases we are seeing in Brazil. Meanwhile, the UK here at 4.6 million is still struggling with the Delta variant, with over 11,400 infections reported in the past day. And the total number of cases around the world stands at 179.9 million. And those are the updates I have for now. Back to you, Sunny.
All right, So, thank you for that. I'll see you on Thursday then. Right, now then, for more domestic coverage on the COVID-19 situation, I have, as So mentioned, our Yujihago here in the studio with me. Welcome, Ji.
Hi, Sunny.
Right, so what are we starting with today?
So let's talk about the status of the fast-spreading Delta variant and the breakthrough infections. And for those of our listeners abroad, we'll also touch upon what you can expect when you come to Korea. Tuesday's regular briefing began with the overview of the new variant cases. Let's take a look.
2020년 12월부터
We have been analyzing domestic variant cases since last December. The rate of positive detection is climbing steadily, and that is also the trend being witnessed globally.
The KDCA official elaborated it's natural to witness new variants evolving from a new virus. The World Health Organization is categorizing the variants that are especially fast-spreading and could negatively affect global vaccination efforts. Each member state, for its part, is trying to conduct as many genome analyses as possible. The WHO recommends each country to complete the analysis on 5 to 10% of its newly confirmed COVID-19 cases. As of May, Korea has finished analyzing 15.6% of confirmed cases, and thanks to these efforts, the country also boasts a 40% detection rate of virus variants. One area of concern for the KDCA, though, is the influx of the Delta variant from abroad. The detection rate for the Delta strain from abroad accounts for nearly 37%. The agency said it will continue to closely monitor the cases from abroad and conduct more genome analysis.
Right. Now, in the meantime, vaccines are our best bet in the fight against COVID-19. But we have come to understand that we still need to abide by prevention measures to ensure complete safety, right?
That is correct. And that's something the KDCA also mentioned during the regular briefing. More than 2 million Koreans have now been vaccinated for more than 2 weeks, but 31 people among them have tested positive for COVID-19. In medical terms, this is called a breakthrough infection when a vaccinated person gets sick from the same illness the vaccine is meant to prevent. This happens when the vaccine fails to provide immunity against the pathogen it's designed to target. So far, 20 people who received the Pfizer shots and 11 people who received the AstraZeneca doses have tested positive, and it appears women and the elderly are more vulnerable. But in the grand scheme of things, 31 infections out of more than 2 million who completed their vaccinations at least 2 weeks ago remains a negligible outcome. This is especially the case when compared to abroad. Another silver lining here is that there have been no serious illnesses or deaths from these breakthrough infections. Let's hear more from the KDCA official again.
역학조사 결과 이 중 11명은
We have confirmed a total of 11 breakthrough infections through our contact tracing analysis. So far, however, they have not led to any deaths, serious illnesses, or additional transmissions.
확진 사례.
Right, and I must say that is quite comforting to hear.
That's true. And breakthrough infections can happen with any vaccinations. And as is the case with the COVID-19 vaccine, the chances are so slim that it's almost negligible to consider that. So this is another testament that the pros of getting vaccinated far outweigh the cons.
Righty. Now, before you go, you mentioned there are a few things that people need to keep in mind if they plan to travel to this part of the world, here in Korea, that is, right? Tell us more.
So, as you know, the local media is very keen to follow the influx of the Delta variant through people coming from India. A 14-day quarantine is still mandatory for those coming from abroad, and they must be tested 3 times during that time frame. For people arriving from India specifically, both Koreans and foreigners must spend the first 7 days at a designated facility before they can spend the rest of the isolation at their own residences. The KDCA stressed the 3 tests and the mandatory institutional quarantine combined is more stringent than the rules adopted in other countries. Those are the main highlights from the KDCA briefing, and I'll be back next week.
Okay, I'll look forward to it. Thank you for today. Right, it's been a policy of carrots with regard to vaccination campaigns in quite a number of countries worldwide. But authorities in Pakistan are now opting for sticks to fight vaccine hesitancy. For more on this, I have Asad Hashim live on the line. Welcome, Asad.
Hi there, thank you for having me.
Right, so Asad, authorities are threatening to cut off cell phone connections and to sit on salaries for those who refuse COVID-19 vaccines. What is the background to these drastic measures?
Yes, I mean, exactly as you've said, it seems like a bit of a carrot and a stick policy out here in Pakistan, where essentially the government vaccination campaign is ongoing and is now open to for walk-in vaccinations to all citizens above the age of 18. And there is a wide variety of vaccines available. The problem in Pakistan seems to be that there is a lack of demand coming from the general public. So what the government is now beginning to try and do is develop these policies of sticks and different sticks that can be used to try and get citizens to just get into the vaccination center. So in Sindh, Sindh province, which is the southern province of the country, the provincial government there has essentially notified that any public sector employees who do not show some form of evidence that they have received at least one shot of the vaccine will no longer receive their salaries until they can show that documentation. In Punjab province, which is the most populous province in the country, it's got more than 100 million people there, the government is now mulling over a proposal to block cell phones for any citizens who are eligible to receive the vaccine and haven't done so yet. So, I mean, that proposal has still not yet been finalized. But the government really is struggling at this point to get over these hurdles with vaccine demand. And I think that seems to be the main problem out here in Pakistan right now.
I see. Asad, do correct me if I'm wrong, but I believe vaccine hesitancy is a deep-rooted reality in Pakistan, and that's probably why polio remains endemic there. But what appears to be aggravating public skepticism over COVID-19 vaccines?
Yeah, it's a complex sort of variety of factors that are affecting this in Pakistan, especially on COVID-19. So on COVID-19, I'd say the problem here is more one of vaccine hesitancy than one of outright anti-vaccine, which can be the case when it comes to the polio vaccine in some pockets of the country, as you rightly mentioned. Now, Pakistan has, for a variety of reasons, had a slightly better experience with the COVID-19 pandemic in terms of the number of infections, in terms of the number of deaths, and at least the rate of severe disease as well, as compared to some European countries and other countries around the world. And so as a result of that, you've got something that is described to me by epidemiologists as vaccine indifference. Essentially, the problem is that because the situation didn't thankfully get as bad in Pakistan as it did in many other places, many people just don't think that COVID-19 is that big a deal. They think that even if they get it, it won't really kill them. And so why take a medication that they may or may not need in their view? Now, add to that, there's also a hesitancy, and this relates to the polio thing. There's a hesitancy on the part of citizens to receive a public sector good that is being given to them for free, and especially something that they see to be supported by foreign powers or the West in particular. I mean, that's a political and ideological issue that's quite deep-rooted. And so if there's a situation where, for example, world powers are calling on Pakistanis to take a particular type of vaccine, in some people that causes a hesitancy or a antipathy as well. And then finally, of course, there are the conspiracy theories that exist all over the world. I'm sure you have them in South Korea as well. It's everything from it'll put a chip in your arm to it's a tracking device to it'll cause enforced sterility. And those are also issues that Pakistanis, I think, are dealing with when it comes to this particular type of vaccine hesitancy.
I see. And Asad, against those odds then, what is the vaccination rate right now in Pakistan and which vaccines are being used there?
So the vaccine rollout began in February, and it started primarily with the Chinese Sinopharm vaccine, which was being given to people over the age of 60 and is continuing to be given to people over the age of 60. Most of the vaccines here have been Chinese so far. So it began with Sinopharm, and now Sinovac and CanSino, which is a single-shot vaccine, are also being administered. Pakistan is in fact also manufacturing or doing the late-stage manufacturing process for some of CanSino and calling it PakVac. And so that's ongoing as well. The problem is, as we discussed earlier, of one of demand. And so this is a country of 220 million people. And as of yesterday, only about 13.8 million doses had been administered. And that's doses, not people who've been fully vaccinated. So it's quite a low number right now. And the primary thrust of the vaccination now seems to be more towards Sinovac and CanSino, and like I said, PakVac as well. And I think most of the government's movement is now towards CanSino, the single-shot vaccine, because that's something that they feel like will cause more people to take it up and also doesn't require a follow-up on the part of citizens. Now, what we are seeing recently, and this is just in the last week, is that there have been some vaccine shortages as well. So even though the rate of vaccination is relatively low, there were some supply-side issues. And so what the government has done as of a couple of days ago is now increase the time period between second shots from 4 weeks, which is the WHO recommended duration, to now 6 weeks. And that's being done explicitly to manage the supply shortages that are coming in. There were a couple of shipments of Sinovac that arrived in the last couple of days, and authorities say that none of these supply issues should be long-term. But again, it's difficult to say, particularly when they're already taking steps to increase the duration between shots beyond what is already there.
Right. And Asad, just out of curiosity, are survivors of COVID-19 also encouraged to get vaccinated in Pakistan?
Yes, very much so. I mean, the Pakistani government essentially wants everybody that can possibly get vaccinated to get vaccinated right now. And like I said, essentially, if you're over the age of 18, you can walk into any vaccination center in Pakistan and theoretically receive a vaccine. There are no specific guidelines that have been set forth by the government for survivors of COVID-19, but what we did see was because there was, and this was something that drove the vaccinations as well, I think, was the third wave of infections in Pakistan kind of coincided with when the vaccination drive was ramping up as well. So you saw an increased demand there. There's no specific guidelines, but the general rule seems to be that as soon as a COVID-19 survivor is able to leave quarantine or leave isolation, they are eligible to receive the vaccine.
Right. Asad, one final very quick question before you go. How are authorities there now working to contain the spread of the Delta variant, given the shared border with India?
This was, I think, something that has been of extreme concern to Pakistan and Pakistan's government. And essentially, the concern is that if something like the Delta variant, which is extremely transmissible, were to spread within Pakistan, it could very, very quickly overwhelm the country's healthcare system. And so what they've done as a result of that is, look, Pakistan and India don't have a lot of direct cross-border trade or cross-border travel. And that's due to the tense nature of the relationship between the two countries, and particularly right now. But what they do have is a lot of shared travel to the Gulf countries. And so Pakistan, even though the numbers from the third wave have now come almost down to pre-third wave figures, and the infection rates are very low, the positivity rate was around 2% today. The test positivity rate was about 2% today. But even then, they've maintained the restrictions on flights at almost the highest level they've been throughout this pandemic. And the reason for that is that most of Pakistan's international travelers go through the Gulf countries. And at those hubs in Dubai, Abu Dhabi, in Doha, and so on, there's a lot of interaction with people from around the world, including people from possibly from India, who also use those hubs quite a lot. And so this is something that they're very, very concerned about. So right now, international flights from Pakistan are down to 20% of their scheduled quota. And every single person who's landing in the country is being rapid antigen tested on arrival. And then there's a very active track and trace policy for anybody who does land, even if they do test negative.
Right, those are some very stringent protocols. All right, Asad, as always, thank you very much for the latest from your end.
Thanks very much. Thank you for having me.
Right, in related news, COVID-19 vaccine support is not simply taking place at government levels, but also on individual levels of interest amid hopes for global well-being. We have more on these goodwill gestures in this report.
Kim Yeona, the 2010 Olympic gold medalist and the retired queen of figure skating, donated $100,000 to fund global efforts in the equitable distribution of COVID-19 vaccines.
전 세계 그 접종률은 한 20% 되지만은 저소득 국가 그 접종률은 1%가 안 된다고 합니다. 이러한 이유에서 이 김연아 대사는 저소득 국가 코로나 보급에 기여하고 싶다고 하셔서 전액을 코백스 퍼실리티에 저희가 전달할 예정입니다.
Kim's donation went to the COVAX facility, a global vaccine partnership that was created to promote the equal distribution of vaccines to all corners of the world. As of now, the COVAX facility has delivered around 85 million vaccine doses to 131 countries worldwide. Leaders of the Group of 7 nations, following their summit in the UK, pledged to donate 1 billion vaccines for their less fortunate neighbors, the bulk of which will be supplied to the COVAX facility. Despite these efforts, huge disparities remain, with vaccination rates in the G7 countries being more than 70-fold higher compared to the developing world. Amid this reality, many individual donations are being made to the COVAX facility. Seo Jung-yup is a Korean pharmacist who recently made a donation to COVAX, having received the AstraZeneca vaccine earlier in April.
백신을 접종하고 그 코백스에 기부를 한 어떤 분의 기사를 우연히 접하게 됐는데요. 그전에는 그 백신을 접종하는 게 당연한 거라고 생각을 했는데 그 분의 기사를 보고 내가 운이 좋아서 대한민국에 태어났기 때문에 접종을 할 수 있었다는 생각을 하게 되었고요. 그래서 그 제가 받은 혜택을 그 다른 사람들과 나누기 위해서 코백스에 기부를 하게 되었습니다.
Seo's efforts did not stop there, and he started a campaign to recruit his colleagues in the donation drive. Lee Sung-woo, who received the Janssen vaccine as a reservist in the Korean military, also donated to the COVAX facility.
백신이란 걸 맞으면 조금 더 안전해지게 되는 거잖아요. 그 위험에서. 근데 이제 먼저 맞을 수 있는 기회가 저한테 왔으니까 그게 약간 다른 사람보다는 더 쉽게 그리고 무료로 맞았으니까 이게 혜택이 된 것 같다 약간 그런 생각이 들더라고요. 저도 그 혜택을 남들에게 좀 나눠줬으면 좋겠다 생각해서 기부를 하게 됐습니다.
This Korean doctor donated $50 on the day he got his second vaccine dose, taking to Twitter and expressing his hope for more vaccines to be distributed in places where they're desperately needed. Another user on Instagram uploaded a screenshot of his donation, saying that small individual efforts pulled together could help bring a speedier end to the pandemic. Donating is easy, and all it takes is a few clicks on the COVAX facility homepage. Individual donations start at $5, which is the price set by COVAX for a single vaccine dose. You can enter your email address and credit card information on the COVAX homepage to pledge a donation ranging from $5 to $1,000. These charitable acts of giving and kindness is helping the world overcome the pandemic, one donation at a time.
주요 선진국 정상들은 방역에서도 경제에서도 기후변화 등 글로벌 현안에서도 우리나라가 이룬 성과에 대해 한결같이 높이 평가했습니다.
전 세계에 이제까지 25억 회분 이상 코로나19 예방접종이 이루어졌고 우리나라는 20위권 안으로 진입했습니다.
While Korea's inoculation drive appears to be proceeding with few glitches, the growing presence of variants looks to challenge its future course, as is the case in some countries. Now, for more on this, I have Professor Kim Moon-gyu from Yonsei University. Welcome back, Professor Kim.
Good afternoon.
And I also have Dr. David Kwak from Soonchunhyang University Hospital. Good to see you again, Dr. Kwak.
Thanks for having us.
Now, Dr. Kwak, the inoculation drive here in this part of the world has been securing media attention as it gains momentum. What are your thoughts on the pace of Korea's vaccination campaign?
Well, just a couple of weeks back, we were celebrating by the achievement that we achieved, that we far surpassed the originally planned 14 million worth of shots given to population. I think we are also surpassing many of the neighboring countries in the fashion that our inoculation rate is much faster than, let's say, Japan or other countries, for instance. We have reached about 25% of inoculation rate for those who have received at least one dosage within about 109 days. That is quite much faster, actually, up to about 10 to 20 days faster than some of the European countries. So I guess we can really applaud ourselves for the achievement. Also, many of the countries, many of the developed countries were in the same starting point when we began our own inoculation, and we're also much faster than those countries, including that of Japan, Australia, and New Zealand. So we are on the right track in regards to boosting up the vaccination rate. Let's hope that we would be able to achieve within September of time enough 70% of the population to be inoculated at least once, and by November of time to be inoculated, to inoculate enough people to reach the herd immunity.
Right. And then, Professor Kim, when can we expect to witness the impact of public inoculations on infection numbers?
There should be some conditions. If we do not have the new variants, if we have enough vaccine supply and nothing more vaccine issues, I think the effects will show off within a few months. But we have to remember that in USA and UK, even in Israel, there was a rise in incidence, even though they started the vaccination. So I think it's not strange that we still have more than 600 cases in Korea right now. One thing we have to remember is that there is a huge imbalance between the OECD countries and the middle, lower income countries. And this variance might happen in the lower or middle income countries and spread into the rest of the world. So it's not a local problem, it's a global problem. So we must work together to overcome this pandemic. So if it all works out well, I think as Professor Kwak mentioned, we're going to see some effects.
Right. And Professor Kwak or Dr. Kwak, what do you believe has been serving then to boost Korea's inoculation campaign?
Well, the biggest point that many of the media sources are pointing out when they're praising our country is the fact that we were very quick to implement the surplus vaccination to be utilized by the most widely used messenger app. So people were able to make registrations for, let's say, no-show vaccines, so-called, very easily through their daily used messenger apps. And for those people who did not want to go through that, they were also able to call, let's say, public healthcare centers or even local clinics to make an appointment for themselves. So it was, I guess, the easy access to the registration of no-show vaccination, surplus vaccinations, was one big point that Korea was able to supply to the population. But also the fact that a big hype among younger generations for the vaccines that were left over is a great factor that worked into achieving such high number. As we've seen from the past a month or so, people, especially the younger generations who are not in time for their own vaccinations yet, were very eager to receive their own shots when chances were given. So they were very fast to apply for these no-show vaccines and surplus vaccines. So I guess the consensus or the shared feelings among our population to receive the vaccine is one probably biggest factor that worked into achieving such great number.
Right. Professor Kim, according to Goldman Sachs, roughly 25% of the global population will have received one dose of the COVID-19 vaccine by the end of this month, that is June. And by November, that figure will reportedly stand at 50%. Now, what is the importance of this number amid hopes to reach herd immunity?
Numbers. Yeah, it's numbers right now. Because Asia is densely populated, world data shows changes that Asia accelerates the speed of the vaccination. And about 3/4 of world vaccination is done in Asia right now. And Korea, I think Korea reached about 30% of their population who had at least one shot, and Japan is approaching 20. And I think China is more than 40 right now. But we have to consider that what kind of vaccination they got, and is there any regional difference within the country, and prevalence of the new variants. So numbers are some kind of quantitative concept, but I think qualitative concept is also very important. So if we want to ease the quarantine measures, every factor should be considered cautiously.
Right. Meanwhile, over in Chile, authorities there are experiencing a rather worrying trend as daily infections persist despite the reality that 61% of the country's target population has been fully vaccinated. For more on the situation there, I have Professor Miguel Orion at the University of Chile live on the line. Welcome to the program, Professor Orion.
Hello, Sunny.
Right. I think there's a small time difference there with my question. I was asking whether you could start with a bit of information about the COVID-19 situation in Chile.
Sure, my pleasure. A warm greeting from the other side of the world. What we can say is in Chile, we are in our autumn winter. We're beginning the winter in a week or so, where it's a time that we know that COVID increases significantly. Nevertheless, we had our upsurge beginning the return from the summer vacations in March, with an increasing curve in autumn, reaching similar numbers that we had last year during the first epidemic curve, although having to say they were doing 3 times the numbers of PCRs. So with that said, positivities have been around 10 to 12%. Chile is a country of 20 million people, where we're having from 6,000 to 8,000 cases per day, around 100 to 120 deaths per day due to COVID-19. That is the bad news. The good news is that most likely with the intense vaccination that we're having in Chile and the measures taken right now, we are at a stable phase, and we're starting to see a decrease in cases since last week, which is quite unusual compared to last year, because we are still in the middle of the winter. So we're seeing hopefully what is a better future.
I see. Professor Ryan, how do you explain then the lack of perhaps tangible impact of the country's impressive inoculation rate on its daily infections, which range between 6,000 and 8,000, you said?
Yeah, this is very important, because I know it's been a matter of world interest of what's happening with the Chile situation, that has currently vaccinated on a first dose around 75% of its population over 18 years of age. And right now we're at 60% of the population receiving the 2 vaccines. And we're still having an increase in cases that now reaching stabilization. I think, as was said by my Korean colleagues, vaccination began here in February with the start of the upsurge of the autumn, late summer and early autumn winter cases. And that's important, because the time you begin vaccination obviously has an impact. Then we are using mostly Sinovac. 90% is using of the vaccine has been Sinovac, around 10% has been Pfizer, and more recently also Oxford, AstraZeneca, and CanSino have been brought to vaccination. With Sinovac, we are very clear, both from the clinical trials and what has been seen in the effectiveness trials, that the overall vaccination effectiveness is around 65% for any infections. It's about 80%, 85% against severe infections. And at the same time, that the efficacy is sustained 2 weeks after the second dose. So there's a lag period from when you start vaccination. So what we are seeing is a combination of all those factors, resulting in that the impact of vaccination was first seen in the more severe cases, with a decrease of the curve of ICU patients over 70, which were the first vaccinated, and then a steadily decline in the lower age groups. And now we're starting to see what we hope is a vaccine effect, which is a curbing or stop of the increase of the curve to a stabilization and hopefully a decline, even though we are in winter, when we know is a station where the virus tends to go high up, but it's now being kept stabilized. And we think that what we're seeing then is the effect of the significant vaccination in the population.
Right. Professor Kim, what are your thoughts on the role of seasonal factors in perhaps boosting the infection numbers in Chile, as Professor Ryan has pointed out?
First of all, many viruses are seasonal in nature, such as coronavirus, influenza virus, and respiratory syncytial virus. COVID-19 belongs to the coronavirus family, and new variants will maintain most of their characteristics. Epidemiologic data shows that lower temperature and higher latitude correlates with the incidence and severity of COVID-19, but the longitude is not so important, reported by University of Illinois. And there's another report from China telling that lower temperature is correlated, but also they insist higher humidity. But I'm not sure about how important humidity is, because we see transmissions under air conditioning situation. So I think it might be a minor factor. And some South American countries is in winter times, and if it is near South Pole, they may have a perfect environment for COVID-19 spread. But I think there are some factors more than seasonal. I mean, we should have a multifactorial analysis, and Korea should control the cluster outbreaks before the winter times. At least we should control one by one, and if we have one less factor, that will be beneficial.
Right, one less factor to worry about.
Yep.
Professor Orion, what can you tell us about the spread of the Delta variant in Chile and its surrounding countries?
Well, to date, the data we have, which is not so much, the sequencing of the viruses is being done in few countries. It's not massive. In Chile, it's being done at a reasonable level, has allowed us to see that in the past couple of months, actually, the variant that has been increasing significantly is the P1 variant. The P1 variant that came from Manaus, Brazil, and that has been associated with increased transmission. And we have shown, and some studies which we should be publishing quite soon, that, and others have shown that it is also associated with an increased possibility of taking people to the ICUs. So there's also a relationship with severity. Fortunately, the little data that has come out suggests that it doesn't have a significant resistance against vaccine coverage. So the vaccines that we're using, especially Sinovac, are covering it pretty well. So that's the P1 variant, which has predominated in South America. The Delta Indian variant has not been detected yet at a very high rate, very low rates in Latin America in general and in Chile. So we're looking at it. We know that it has increased transmission. Fortunately, there are studies now that show that the vaccines are working quite well against this variant. So probably will be predominating, but it will not hopefully cause the enormous struggles that would be if the virus were not to be covered with the current vaccines.
Right, hopefully. Now, among the countries with impressive vaccination numbers like Chile, countries like the UK and Israel also marking resurgences, Dr. Kwak. What do you suppose is perhaps challenging containment efforts there, aside from the presence of variants?
I think, well, I would have to blame really the complacency here. So when, let's say, for example, Israel hit 60% mark, they were very eager to reopen their businesses and let people go back to their normal daily lives as they used to have before the pandemic. And that means people were now being a little more pushed towards being reluctant to wear the masks as usually they did. So it's the complacency among people that they would tend to gather a little more, and they would tend to attend schools or office surroundings a little more without any protection, which would expose them to these transmissions. But on top of that, as we are seeing, these new variants are spreading much faster. So they're much quicker to reach a person if that was to transmit among the unprotected people. So vaccination has its role in protection against the viral transmission, but it would not be able to completely block out people when they come into physical contact. So that's one particular factor that I'm kind of worried about our own country here, because we are also about to open more schools to children attending daily, and also we are planning to allow people having been inoculated once or twice to be more freely walking in and let out without masks. So those are some of the incentives that we have to be really careful not to implement too prematurely at this time.
Right. And Professor Orion, keeping in mind what Dr. Kwak has just said here in the studio, what can you tell us about perhaps social distancing and other measures like mask wearing in Chile to go along with vaccination efforts?
Well, I must say that South Korea must be congratulated as a country, as a society, due to the discipline of its population that has certainly been extremely important to be able to control this virus. I think that has been a big difference in the few countries around the world that have been really capable of doing an adequate, a reasonable control. And in most of the other countries in the world, including most of the South American countries in Chile, it has been much more difficult to have the populations to comply as strictly as necessary. There's been compliance, but not as strict as necessary to be able to keep the virus in lower levels of circulation. And now that we're a year and a half almost of the pandemic, we have what's called pandemic fatigue very clearly. We have been going on and off with what are supposed to be strict quarantines based on the number of cases increasing specific regions or cities. But those quarantines would be obeyed quite strictly by the population initially, leading to up to 45-50% of reduction of mobility, which is measured quite well by several groups here in Chile. But right now, those quarantines only reach 20-25% decreased mobility when they're installed. And this is just telling that people at this point are tired. They're hopeful with vaccinations, but they're not so eager or ready to comply with the limited mobility, which also has very significant impacts on the people's lives, the people's journals, works, and sustainability. So this is always an ongoing discussion, the balance that you have to have here, the health balance to keep people alive and safe at the same time, allowing people to move, but hopefully not so much. It's a day-to-day struggle, but I think that right now, thanks to the combination of vaccination and to the low mobility that we get with the different measures, we are starting to have a reasonable balance, and hopefully within the next 2 or 3 months when our spring season comes up, and we should start seeing a significant decrease in cases, together with over 70 to 80% of the population having 2 doses of vaccines, we are hopeful that we will start to see a very significant decline in cases.
Right, hopefully, of course. Professor Kim, meanwhile, going back to what Dr. Kwok mentioned earlier as well, what efforts do you suppose are necessary to ensure that our planned ease restrictions for starting July will not trigger massive outbreaks?
We are observing outbreaks in UK, even though they had vaccinated more than 60% of their population. And I think it's because of the Delta variant, which is highly infectious. And let's say if you belong to the high-risk group and you are not vaccinated, please visit the clinic or vaccination center that have the vaccination. And I think from next month we're going to have a new guideline, but regard that indoor activity is same as this month. I mean, don't think that we're getting freer, especially at the pubs and karaoke and sauna facilities. And I think people will start traveling abroad from July. So even though you are free to go, but still you have to keep in mind that you might encounter some new variants and new environment, and when you come back, you might bring it back home. So please be cautious and keep the guidelines.
Right, for your health and for that of those around you.
Yep.
Dr. Kwok, how should authorities prepare for a possible plateau in participation in the country's inoculation drive as it is extended to the broader public?
One symbolic phrase that I heard from my colleague was that he was a very young male who recently received the shot. He was basically saying that if he had the infection, he might not have felt the pain that he had from the vaccination. These are the mindsets the younger generations kind of have as a fear of getting vaccines. So we need to maybe think about carefully how we could give more incentives to people who are more reluctant to receiving vaccines. Those are some of the thoughts that we have to give as a public implementation.
Right, and Professor Arirang, very briefly speaking, how do you respond to concerns over vaccinations amid the pandemic?
I would say that this is the most significant challenge we will have probably as in humanity and in our lifetimes. And the only solution to move forward to a what we thought or is a normal life, we'll be having the whole world vaccinated against COVID-19. So that is a huge struggle, but that is the challenge. And hopefully, the sooner the better we are able to do that, the sooner the better we will be able to go back to the world as we knew it before COVID-19.
Right, we'll keep our fingers crossed for that. Professor Ryan, thank you very much for your time and your thoughts. Professor Kim here in the studio, thank you very much for being with us today. And Dr. Kwok, as always, thank you very much for your insights.
Thank you.
Right, well, that brings us to the end of this edition. Join us again on Thursday for an in-depth look at the Delta variant that is threatening containment efforts in quite a few countries. Thank you for watching.